Karen Deckman, you're a registered dietitian with Dr. Menegat's bariatric surgery patients. You see them well before surgery. What happens when you first see them? What do you do?
They come in for an initial consultation, and we take into account their past medical history, medications, situations such as their current weight or their height, so that we can verify a proper diet for them for pre-surgical conventional weight management therapy.
Do you ask them about their current diet?
We do assess their current diet as well as any cultural or dietary considerations, as well as any food allergies, to take every individual accommodation for their diet planning before surgery, so that a plan can be established for them so that they can lose some weight before surgery, or at least learn the guidelines to a healthy, sensible diet for that individual.
And what do you tell them about what will happen after surgery? There is a reduced amount of food that they're going to be eating. How do you break that to them, and how do they react to it?
We have several classes at Echelon Bariatric, and they do learn pieces of the post-surgical diet one step at a time. And during that education, we do give them some realistic facts, such as what the 1 to 2 ounces per hour that they will be eating after surgery really looks like, as well as sample menus so that they know what they will be following after surgery.
Now, what does that mean, 1 to 2 ounces per hour? Is it, they don't have to eat every hour, right?
In the initial diet phase, they're on a clear liquid phase where it literally is a restriction of 1 to 2 ounces per hour, but that is for a limited time frame, and then they would progress to different diet phases. But initially they are restricted to 1 to 2 ounces per hour, which they do eat literally every hour.
And that lasts for a matter of weeks?
Per the doctor's prescription, it would last. Typically it's around a week, but Dr. Menegat does prescribe the diets and the dietary regimens.
Now, doctor explained to us the difference between the restrictive and the malabsorptive type of surgery. Does it matter what kind of surgery they have, or is the diet pretty much the same?
The dietary standards are basically the same, but there are considerations for the individual surgery as well as the individual patient. And so the doctor does do an individual diet prescription based on protocol for each patient.
And primarily, can you break down for us the types of food they can eat and cannot eat?
Basically, it depends what diet phase they would be on, and every phase has specific rules, so that they can receive. The first stage would be clear liquids, which would consist of things like apple juice or broth or hot tea, as well as other clear liquid items that are sugar-free and low-fat, and they eat those items 1 to 2 ounces per hour, every hour that they're awake.
And whatever stage they're in, at some point, they have to realize it's going to be a healthy diet and not ice cream sundaes and, I guess, potato chips, right? I mean, there are certain foods that are off the list.
Correct. We give them a menu, and on that menu has specific foods which were approved by the physician, depending on which diet phase they are in. And on that menu is foods that they're allowed. The rule of thumb is that if it's not on our menu, they are not allowed to eat it.
Now, that can be fairly foreboding for people who are wanting to enjoy food. Can they still enjoy food, and can food be still as tasteful as it has been in the past for them?
We get quite creative with the recipes that are from the foods that are permitted. We make up recipes, we make up solutions, we offer them alternatives so that they can still be creative and enjoy healthy, low-fat, tasty meals and snacks.
What are some of the more interesting and popular foods that people find on diets like this?
It depends what dietary phase they're on. But as they progress from a soft diet to, say, a regular diet, and they're more post-operative, maintaining a soft, low-fat, regular diet, we do have a lot of our patients tend to eat a lot of fish, some low-fat chicken. They also tend to enjoy sugar-free puddings, as well as cottage cheese, and several soft fruits and vegetables as tolerated.
Do you see breakthrough moments when patients come to you and you understand that they finally have gotten it, they understand the value and the payoff of this diet?
Absolutely. Oftentimes patients are very thrilled. They stand up and show how loose their pants are fitting, In addition, we do refer to the term, nothing tastes as good as the feeling of thin feels. So a lot of patients do reveal that the feeling of meeting their goals is much more satisfactory than eating uncontrolled meals and snacks, as well as not only the weight issue, but the health concerns that sometimes are reversed because of this surgery. They are feeling healthier, they are feeling better about themselves, and it makes the diet easier for adherence.
There are probably patients out there, or obese people, looking on the internet who find it hard to believe that they could ever relegate food to a minor or lesser role in their lives, that food will not always be that important to them. You've seen it work.
I've seen it work, and I do believe in the interdisciplinary approach with both the physician, the clinical psychiatrist, myself, and even the office staff. You know, I do believe in the interdisciplinary approach and the screening criteria to make sure that these patients are a candidate for this type of surgery.
And what do you think of this large team that has been put together?
This is an excellent team, and I'm happy to be a part of the team.